Have you ever noticed that you don't actually have to think about standing up straight? Whether you're walking, jumping, or just standing still, your body knows exactly how to stay upright against gravity without you ever checking in. That automatic balance happens because you have a built-in control room working in the background. Think of it like a carpenter's bubble level inside your head, constantly making tiny adjustments to keep you perfectly centered. This control room is a small structure deep in the brain called the posterior thalamus. This is the physical compass that tells you which way is up. As long as this compass is functioning, you can move through the world effortlessly, trusting your internal sense of verticality. But sometimes this hardware is interrupted. If a stroke occurs and damages the posterior thalamus, the internal compass takes a direct hit. After a stroke, it is common to experience severe weakness or even total paralysis on one side of the body. While therapists treat one-sided weakness every day, damage to this specific gravity control room causes a reaction that looks very different from a typical stroke. This reaction is called pusher syndrome, and it changes how a person perceives the physical world. The stroke didn't just weaken the muscles, it broke the brain's ability to feel gravity correctly, trapping the person in a confusing new physical reality. To an observer, the symptoms are baffling. The person will use their strong arm and leg to forcefully push themselves away from their stable side and toward their paralyzed side. This is dangerous. By shoving their weight toward the side that can't support them, they lose their balance and fall over. When a therapist tries to help by guiding them back to a safe, upright position, the person often resists. They will push back against the therapist, struggling to stay in that tilted position. It raises a difficult question. Why would someone fight the person trying to keep them from falling? This resistance isn't a problem with their muscles or their personality. It is a genuine mistake in how they perceive reality. To understand the behavior, we have to look at the world from the patient's perspective to see how their broken compass is reading the room. For a person with this syndrome, the brain's data is skewed. The damaged compass now reports that the body is perfect and straight only when it is actually tilted 18 degrees toward the weak side. They aren't trying to fall. They are heroically trying to straighten up based on the only data they have. To them, leaning 18 degrees toward the floor feels like standing as straight as a pillar. Now imagine the therapist's help from the patient's point of view. When the therapist moves them to a true physical vertical, the patient's brain says they are being shoved 18 degrees sideways. They feel like they are about to be pushed off a cliff. They are trapped in a distorted version of gravity, where the only way to feel safe and upright is to push themselves over. If your body's feeling of gravity is actively lying to you, how do you ever learn to stand up again? The answer lies in the fact that while the brain's sense of gravity is broken, the visual system, their eyesight, is usually still working perfectly. Therapists use this as a workaround. They use clear, straight lines in the room as anchors, like the edge of a door frame, a window, or a line of tape on the wall. The therapist asks the person to look at those lines and compare them to what they feel is upright. It creates a direct conflict between what the eyes see and what the body feels. The patient has to use logic to bridge the gap. They can see that the door frame looks slanted, but they know that buildings don't lean. If the house is straight, then the feeling in their body must be the thing that's wrong. By deciding to trust their eyes instead of their physical sensations, they can manually override that broken compass and guide themselves back to center. Practicing this visual check helps the person stand safely in the moment, and it also kickstarts a physical repair process deep in the brain. This is neuroplasticity. The brain begins to rewire itself, creating new neural pathways to send signals around calibrates. The brain learns to find true vertical again. Eventually, the person regains their balance. The terrifying need to push themselves over fades away as their internal compass finally syncs with the world. Pusher syndrome shows how much we rely on tiny hidden signals to understand our world. But it also shows that when our reality is tilted, the brain has the capacity to find its way back to the truth.